Hello, this is a Stories from the Camp. Thank you for visiting us. It would be great if you subscribed and gave us a like, and also write a comment. Enjoy listening. In the Soviet Union, medicine was both a symbol of socialist pride and a harsh reflection of its contradictions. The state loudly proclaimed free and universal health care as one of the crown jewels of communism. Massive posters declared victories against epidemics, extolled heroic doctors in white coats, and promised a future where no one would suffer without treatment. Soviet citizens were told they had the best healthcare system in the world, scientific, rational, and equal for all. But beyond the polished slogans and statistics, the real experience of Soviet medicine was far more complicated. For millions, the hospital was a place of dread rather than comfort. The shortage of basic supplies, overworked and underpaid doctors, and the omnipresent queues were not the exceptions. They were the norm. Medicine became a game of survival, where personal connections mattered more than symptoms, and improvisation replaced infrastructure. At times, ideology mattered more than science. Certain diseases were ignored because they were bourgeois, and new treatments were delayed if they didn't fit Marxist-Leninist theory. This video explores the world behind the curtain, from the rise of the Soviet medical system under Lenin, through the paranoia of Stalin's purges, to the crumbling wards of the late Soviet era. It is a journey through antiseptic corridors, whispered diagnoses, and the strange paradox of a system that promised so much and delivered so unevenly. Before the Soviet Union could boast of its centralized and ideologically driven healthcare system, it inherited a deeply fragmented and underdeveloped medical infrastructure from the Russian Empire. At the dawn of the 20th century, Imperial Russia was a vast and unevenly modernized country. While cities like St. Petersburg and Moscow had begun to adopt modern hospitals and embrace scientific medicine, the overwhelming majority of the population, peasants living in rural areas, had little to no access to trained medical professionals or even basic health care. The rural population, which made up around 80% of the empire, was often cared for by so-called zemstvo doctors. These physicians were part of the local self-government institutions established in the 1860s and were meant to bring basic services like education and medicine to the countryside. However, a single zemstvo doctor might be responsible for treating tens of thousands of people spread across hundreds of kilometers. Their supplies were minimal, their salaries low, and their working conditions harsh. Most lacked proper equipment, transportation, or even buildings to work in. Often, they would travel by horse-drawn cart from village to village, carrying little more than rudimentary surgical tools, bandages, and perhaps some quinine or iodine. In many places, medical care remained rooted in folk traditions. Village healers, herbalists, and religious figures provided the majority of treatment. Illness was frequently interpreted through spiritual or moral frameworks. Diseases were seen as divine punishment or the result of evil spirits. People turned to icons, holy water, or pilgrimages before seeking any kind of clinical intervention, if such an option even existed. Vaccination, while legally required in some cases, was widely resisted, and many peasants feared or distrusted official medicine. Urban medicine was more advanced but still limited. By the early 1900s, medical universities and scientific societies were emerging, producing educated doctors who engaged with European medical advances. Yet access to this modern care was highly stratified. The upper classes had private doctors, expensive clinics, and even access to foreign specialists. The working classes and poor often relied on overcrowded charity hospitals or industrial infirmaries provided by factories, which serve as much to keep laborers productive as to cure them. Sanitation was another severe problem. Epidemics of typhus, cholera, tuberculosis, and diphtheria swept through both cities and countryside with regularity. Clean drinking water was rare, sewage systems were limited, and malnutrition was endemic among the poor. Infant mortality was staggeringly high. According to some estimates, nearly 250 out of every 1,000 infants in Russia died before their first birthday in the early 20th century, a rate higher than in most European nations at the time. This legacy of neglect and inequality in the healthcare system was one of the justifications used by the Bolsheviks after the 1917 revolution. They argued that only a centrally planned and publicly owned medical system could solve the deep disparities inherited from the old regime. The state would replace the patchwork of religious, local, and private providers with a unified approach to healthcare, one that aligned with socialist ideals of equality and scientific rationalism. In the rhetoric of early Soviet planners, the doctor would no longer be a servant of the rich or an isolated country physician, but a soldier of the proletariat, a figure of enlightenment who would cleanse the body politic as well as the body physical. But while the rhetoric was revolutionary, the material conditions were not. The Soviet government began with little in terms of infrastructure, supplies, or personnel. The Russian Civil War and the collapse of the imperial system had left hospitals looted, doctors scattered, and epidemics raging. Typhus and Spanish flu decimated entire communities. It would take years for even the basic framework of the Soviet medical system to begin to function. Thus, the foundations of Soviet medicine were laid not upon a well-established legacy of care, but on the ruins of a crumbling imperial system that had long failed its people. This context shaped everything that followed. The centralization of healthcare, the glorification of state medicine, the suspicion toward traditional or religious practices, and the deep desire to portray medicine not just as a service, but as a political tool in the battle for progress. The October Revolution of 1917 marked not only the overthrow of a political order, but also the radical reimagining of nearly every facet of life, including healthcare. Medicine was no longer simply a profession or a system of service provision. In the early Soviet Union, it became a revolutionary project in itself, an ideological mission to reshape both the individual body and the collective body of a new socialist society. For Lenin and his successors, the health of the citizen was inextricably tied to the health of the state. To build socialism, one had to build strong, productive workers, and to do that, medicine had to be brought under total state control. One of the earliest acts of the Bolshevik regime was the nationalization of all medical institutions. Private clinics, hospitals, and pharmacies were seized by the state. Healthcare was declared free and universal, at least in principle, and placed under the authority of a centralized institution, the People's Commissariat of Health, established in 1918. This was a radical move in a world where most countries still relied heavily on private or religious. Healthcare networks. In the Soviet model, doctors were state employees, and healthcare was to be delivered according to central planning rather than market demand. The vision was sweeping. Soviet medicine would not only treat the sick, but prevent illness through state intervention in hygiene, housing, nutrition, and labor conditions. The new state would eradicate the plagues of the old regime: illiteracy, superstition, venereal disease, alcoholism, and malnutrition. Clinics were to be established in factories, collective farms, schools, and worker clubs. Doctors would no longer sit in offices waiting for patients. They would go out into the streets, fields, and tenements, armed with vaccines and pamphlets, bringing enlightenment and penicillin alike. This era also witnessed the development of sanitary enlightenment, a massive public education campaign aimed at transforming the way Soviet citizens thought about health. Posters, radio broadcasts, traveling theater troupes, and pamphlets carried messages about hand washing, vaccinations, safe sex, and proper nutrition. The body was politicized. Keeping oneself clean and sober became not only a matter of personal well-being, but a duty to the revolution. Hygiene was not just medical, it was ideological. In parallel, the Soviet state invested heavily in medical research, particularly in areas that aligned with its ideological goals. Soviet science emphasized prevention over treatment, public health over individual care, and mass statistics over personalized diagnostics. Experimental treatments were explored with mixed levels of ethical oversight. Psychiatry became both a field of genuine study and, later, a tool of political repression. Soviet researchers pioneered early work in immunology, epidemiology, and environmental medicine, and the USSR quickly built a reputation for strong public health campaigns, especially in eradicating diseases like typhus and cholera. However, ideological zeal often collided with scientific realities. The most infamous example is the rise of Trofim Lysenko, an agronomist who rejected genetics in favor of politically favored pseudoscientific theories. His influence spilled into medicine, where his rejection of Mendelian genetics hindered legitimate biological research. Doctors and scientists who resisted were branded as bourgeois or reactionary, and some were purged or imprisoned. The same system that promoted health care for all also suppressed dissent and subordinated science to party dogma. Despite the ideological constraints, there were remarkable achievements. Soviet medicine became one of the first in the world to build a state-run, fully free medical service covering an entire country. During the 1920s and early 1930s, the USSR launched large-scale vaccination campaigns, reduced maternal and infant mortality in cities, and expanded rural clinics. Soviet doctors developed new surgical techniques and adapted Western methods to the conditions of scarcity. But the price of centralization was rigidity. The system emphasized quantity over quality, and metrics often mass failures. A hospital might report successful vaccination of 98% of the population, but omit that the vaccines have been stored improperly or administered in chaotic conditions. Moreover, the ideological suspicion of Western medicine meant that some of the most important global advances were ignored or delayed. Ultimately, revolutionary medicine in the USSR was defined by contradiction. Bold ideals tempered by bureaucratic inertia, groundbreaking public health campaigns hampered by ideological dogma, and sincere care for the masses distorted by central planning. It was medicine as social engineering, an instrument to mold the Soviet citizen, not simply to heal them. The death of Joseph Stalin in 1953 marked the beginning of a new era across all aspects of Soviet life, including healthcare. Nikita Khrushchev, who emerged as the new leader of the Soviet Union, ushered in a period often referred to as the Thaw. In contrast to Stalin's iron-fisted rule, Khrushchev's administration pursued limited liberalization, decentralization, and reform. These efforts extended to the medical system, where decades of centralized control and ideological distortion had taken a heavy toll. Khrushchev aimed to modernize Soviet healthcare, improve access, and reduce inefficiencies. Yet, like many of his initiatives, these reforms were uneven in execution and mixed in outcome. One of the most significant changes Khrushchev initiated was the decentralization of healthcare administration. Under Stalin, virtually all decisions regarding medicine, budgets, hiring, supply chains, were made from Moscow, regardless of regional needs. Khrushchev attempted to shift responsibility to local Soviets and regional health committees. In theory, this allowed for greater flexibility and responsiveness. In practice, however, it often resulted in bureaucratic confusion and mismanagement. Many local officials lacked the training or resources to manage healthcare delivery effectively. Supplies were still slow to arrive, corruption remained rampant, and rural areas were particularly neglected. Another major focus of Khrushchev's healthcare reforms was expanding primary care and public health infrastructure. Polyclinics, outpatient centers designed to provide general and specialized care under one roof, became central to this vision. These facilities aimed to reduce reliance on hospitals for non-emergency treatment and emphasize preventive medicine. Workers and schoolchildren were required to undergo routine checkups, and a national vaccination program was expanded to combat diseases such as tuberculosis, diphtheria, and polio. This was one of the relative successes of the era. By the early 1960s, infectious diseases had declined significantly in urban areas. However, these improvements came with trade-offs. The focus on quantity over quality persisted. Thousands of new doctors and nurses were trained, but many received substandard education from poorly funded institutions. The system prized fulfilling numerical quotas, number of patients seen, beds occupied, or procedures performed, over actual medical outcomes. As a result, the experience of care remained impersonal and often inadequate. Khrushchev also introduced controversial changes to hospital infrastructure, notably the construction of rural medical outposts and small-scale hospitals in agricultural collectives called kolkhozy and sovkhozy. While these facilities theoretically extended care to the countryside, they were chronically underfunded, understaffed, and poorly equipped. Many were staffed by feldshers, mid-level practitioners with limited training, rather than fully qualified physicians. Some outposts lacked running water, proper sanitation, or even basic medicines. Nevertheless, the symbolic presence of healthcare in even the most remote parts of the USSR served the regime's narrative of socialist progress. Ideologically, Khrushchev maintained the view that medicine should serve the collective and be free at the point of use. However, his government was less concerned with using healthcare as a tool for repression compared to Stalin's regime. The use of psychiatry for political purposes, while not abolished, became less frequent during Khrushchev's tenure. Still, the groundwork for future abuses remained intact, especially in the classification of certain behaviors or beliefs as psychiatric disorders. A peculiar and often overlooked aspect of Khrushchev-era healthcare was his interest in scientific modernization, particularly the use of space-age medical technology. The USSR's obsession with space exploration extended to the biomedical field, where Soviet scientists experimented with telemedicine, remote diagnostics, and physical conditioning techniques used on cosmonauts. However, these high-tech ambitions stood in stark contrast to the crumbling conditions in many hospitals and clinics. Toward the end of his leadership, Khrushchev's sweeping reforms faced growing resistance from within the party. His rapid decentralization created power vacuums. His rural programs were expensive and unpopular, and the healthcare system, like many Soviet institutions, remained plagued by inefficiency and stagnation. By the time of his ousting in 1964, many of his medical reforms were quietly rolled back or left to decay. In retrospect, Khrushchev's impact on Soviet healthcare was significant but limited. He succeeded in slightly expanding access and reducing some of the ideological pressures that had distorted the system under Stalin. Yet he failed to establish a sustainable model of care that could balance quantity with quality or central planning with local needs. The fundamental weaknesses of the Soviet medical model, bureaucracy, underinvestment, politicization, remained unresolved, setting the stage for further decline in the decades that followed. The legacy of Soviet medicine is a complex and often controversial subject. For decades after the collapse of the USSR, narratives surrounding the healthcare system ranged from nostalgic idealization to harsh criticism. In recent years, however, there has been a growing interest in evaluating the Soviet medical model with a more nuanced perspective, balancing its achievements against its failures and exploring how its legacy continues to shape post-Soviet healthcare systems. One of the most enduring contributions of Soviet medicine is the concept of universal healthcare as a state responsibility. At a time when much of the world still treated healthcare as a privilege, the USSR framed it as a basic human right. This idea has persisted in many post-Soviet states, including modern Russia, where access to free medical care remains enshrined in the Constitution. Even though the quality and availability of services vary widely today, the principle that the state should guarantee health care for all is a direct inheritance from the Soviet era. Another lasting feature is the centralized, hierarchical structure of medical administration. The Soviet model favored top-down control, where ministries dictated policy, allocated resources, and monitored performance. While such a system allowed for rapid mobilization, during crises, such as epidemics or natural disasters, it often stifled innovation and responsiveness at the local level. After 1991, many newly independent states struggled to reform this rigid structure. Some countries privatized parts of their systems, while others attempted to maintain state control but faced chronic underfunding and brain drain. Perhaps the most tangible legacy lies in infrastructure. Thousands of hospitals, clinics, sanatoriums, and research institutes were built during the Soviet period. While many of these facilities are now outdated or undermaintained, they still form the backbone of public health care across much of the former USSR. In some places, Soviet-era polyclinics, those one-stop neighborhood outpatient centers, are still in operation, serving millions of patients every year. Soviet medical education also left a significant imprint. The USSR trained legions of doctors and nurses through an extensive network of medical institutes, many of which continue to operate today under different names. However, the curriculum was often criticized for being overly theoretical and lacking in practical training. Modern efforts to modernize healthcare education in Russia and other former Soviet republics still grapple with this legacy, trying to strike a balance between the scientific rigor of Soviet instruction and the more patient-centered, hands-on approaches found in Western systems. But the Soviet legacy is not without its darker aspects. The overemphasis on statistics, central planning, and fulfilling bureaucratic targets often led to distorted data and inflated success claims. Preventive medicine, while celebrated in theory, was inconsistently implemented in practice. Chronic conditions, mental health, and geriatric care were neglected in favor of politically favorable metrics like infant mortality or vaccination rates. Even today, public distrust in official health statistics in Russia and elsewhere can, in part, be traced back to this culture of reporting for the state rather than for the patient. Another controversial legacy is the politicization of healthcare. During the Soviet era, ideological conformity could shape everything from medical research agendas to access to care. Dissenting doctors risked censure, exile, or worse. Psychiatric institutions, in particular, became infamous tools of political repression, where so-called anti-Soviet elements were diagnosed with invented conditions like sluggish schizophrenia. This abuse left deep scars on the reputation of Soviet psychiatry and continues to haunt its successors. Yet, it would be unfair to view Soviet medicine only through the lens of its flaws. In many ways, it was a bold experiment in socialized medicine that achieved remarkable feats under difficult circumstances. It eliminated mass illiteracy about hygiene, eradicated many infectious diseases, and created a networked, hierarchical system of medical care accessible even in remote regions. For many ordinary citizens, Soviet medicine offered a sense of security and dignity, something they felt they lost during the chaotic transition of the 1990s. In the end, the Soviet healthcare legacy is a paradox, a system that guaranteed access but often failed in quality, that prioritized prevention but frequently ignored chronic suffering, that trained brilliant scientists while suppressing dissent. Its echoes are still heard today in debates about healthcare reform, medical ethics, and the role of the state in protecting public health. For better or worse, the story of Soviet medicine did not end in 1991. It lives on in policy, infrastructure, and memory. The story of Soviet medicine is not easily summarized. It is not a tale of clear victories or complete failures, but rather a tapestry woven from contradictions. It was a system built with grand ideals and compromised by brutal realities, a framework that offered hope to millions while sometimes denying them dignity. Soviet healthcare was a world where polyclinics stood as proud symbols of progress, even as supply shortages made sterile gloves a luxury, where brilliant doctors labored in aging buildings, fueled by both ideological fervor and professional duty, where medicine was free but not always effective, and where health itself became a political project. At its core, the Soviet approach to medicine was deeply collectivist. It viewed the population not as individual patients, but as a biological resource to be managed for the good of the state. This utilitarian philosophy shaped everything, from how hospitals were designed, to how doctors were trained, to how public health goals were measured. The body was not private, it was part of a larger machine. Disease was not just a personal misfortune, it was a threat to the productivity of the socialist organism. This model led to some undeniable achievements. The USSR eradicated smallpox and polio within its borders. It brought medical care to distant rural villages and Arctic outposts. It fought tuberculosis with an aggressive, state-led campaign. In cities, multi-specialty polyclinics made it easy to see a neurologist, gynecologist, or pediatrician under one roof, all without a bill. Medical education was free, and research, at least in some areas, was cutting edge. For millions of people across the Soviet Union, especially in its earlier decades, the healthcare system worked, and it worked with a kind of predictability and accessibility that remains rare even in the developed world. And yet, these successes rested on shaky ground. The quality of care varied wildly. Innovation often stalled, especially in the biomedical sciences, where ideological purity could override empirical evidence. Hospitals were chronically underfunded, medicine was rationed, and bribery, though illegal, became a de facto method of getting better treatment. While preventive care was praised on paper, many Soviet citizens learned to avoid doctors unless absolutely necessary, fearing not only poor service, but sometimes also shame, bureaucracy, or even misdiagnosis. Mental health care, in particular, was a disaster area, underfunded, stigmatized, and weaponized against political dissidents. In many ways, the contradictions of Soviet medicine mirror the contradictions of the Soviet Union itself. Grand visions met limited means. Ideals of equality clashed with the hierarchy of privilege. Control brought efficiency in some areas, but created inflexibility in others. There was always a tension between what the state claimed and what the people experienced. The Ministry of Health could boast about record vaccination rates, while rural clinics went weeks without bandages or antibiotics. Health was both a national achievement and a private struggle. Today, the legacy of Soviet medicine continues to haunt and shape post-Soviet societies. In Russia, Belarus, Kazakhstan, and beyond, remnants of the old system are still visible. In architecture, policy, and even in the attitudes of patients and doctors alike. Trust in public health care remains fragile, shaped by decades of overpromising and underdelivering. Reform efforts often oscillate between modernization and nostalgia, torn between the desire to emulate Western systems and the urge to preserve what once worked. Yet for all its flaws, Soviet medicine leaves behind an important lesson: that healthcare cannot be treated as an afterthought, as a luxury, or as a commodity to be purchased only by the fortunate. The Soviet system was not perfect, not even close, but it was one of the boldest attempts in the modern world to make healthcare universal, coordinated, and free. In the end, Soviet medicine was a paradoxical creature, rigid yet adaptive, advanced yet outdated, compassionate yet bureaucratic, noble in intent yet flawed in practice. It was a system that sought to heal millions while serving the needs of the state, a model that aimed to put health in the hands of every citizen, even if the reality was sometimes far from the dream. And for all its contradictions, it remains one of the most ambitious experiments in medical history, a reminder that how we treat the sick says as much about a society's soul as it does about its science. In the Soviet Union, medicine was never just medicine. It was politics. It was propaganda. It was a tool for shaping the new Soviet man. Healing the body was important, but shaping minds, behaviors, and allegiances through healthcare was arguably just as vital. In this final chapter, we take a deeper look at how the Soviet state used the healthcare system not only to treat disease, but to build and control society itself. From the earliest years after the revolution, Soviet leaders understood that health was power. A healthy worker was a productive worker. A healthy soldier was a loyal defender of the state. But more than that, health was a symbol, a sign of the superiority of the socialist system. Lenin himself declared that the health of the people is the foundation of all our work. With this mandate, medicine was enlisted not just in service of biology, but of ideology. The very structure of Soviet healthcare reflected political goals. It wasn't just centralized, it was centralizing. Decisions came from above and rippled down to the smallest clinics, ensuring uniformity not just in treatments, but in values. Physicians weren't seen as independent professionals, but as state functionaries. They served not the patient, but the plan. Their work was measured not by satisfaction or outcomes, but by quotas, targets, and bureaucratic alignment. This ideological framework was particularly evident in preventive medicine. On the surface, prevention is a noble goal. But in the Soviet context, it often became a way to monitor, regulate, and correct the population. Hygiene inspections weren't just about stopping disease, they were about discipline. School health screenings doubled as tools for assessing ideological conformity. Public health campaigns, featuring posters of smiling mothers and strong, shirtless workers, were less about biology than about broadcasting the Soviet ideal. Mental health, of course, was the darkest expression of medicine as ideology. In the West, psychiatry is often a field for empathy, exploration, and healing. In the USSR, it became a political weapon. Dissidents were diagnosed with sluggish schizophrenia, a uniquely Soviet invention meant to pathologize disagreement. Those who challenged the system, through speech, protest, or even private thought, could be labeled mentally ill and locked away in psychiatric hospitals. There, they were treated with powerful drugs, isolation, and sometimes physical abuse. The goal wasn't healing, it was erasure. Psychiatry became a mechanism not for understanding the mind, but for enforcing obedience. Reproductive health was also shaped by ideology. Abortion, for instance, was legalized in the 1920s, then banned under Stalin, and later re-legalized, each shift reflecting not medical considerations, but state policy. Women's bodies became battlegrounds for demographic planning. Childbirth was incentivized or discouraged based on national needs. Contraceptives were often unavailable not due to medical debate, but because they contradicted the state's prenatalist priorities. Even language was ideological. The patient was not a client or an individual. They were a citizen. The doctor was not an advisor or advocate, but an agent of the socialist state. The language of choice and consent, so central to modern medical ethics, was largely absent. Medicine was a public good, yes, but also a public duty. One's health, like one's loyalty, was a responsibility to the collective. Of course, not every Soviet doctor was a tool of the regime. Many were compassionate, skilled, and quietly resisted the system's ideological overreach. Patients developed informal networks, BLAT, as it was called, to navigate the system, find sympathetic doctors, and obtain better care. In this underground layer of Soviet medicine, the human spirit often triumphed over the bureaucratic machine. But the fact that such informal workarounds were necessary says a great deal about how deeply ideology shaped the system. Today, echoes of this ideological legacy remain. In many post-Soviet countries, the doctor is still viewed with a mix of reverence and suspicion. Medical decisions are often accepted without question, not because of trust, but because of a lingering culture of deference to authority. In some regions, politicization of public health continues, whether in the handling of pandemics, vaccine campaigns, or the treatment of mental illness. In the end, the Soviet medical system reveals a powerful truth. Healthcare is never neutral. It reflects the values, priorities, and fears of the society that builds it. In the USSR, those values were collectivist, hierarchical, and deeply political. And so the medicine followed suit. And so, as the fire fades and our story draws to a close, we look back not at a perfect system, nor at a total failure, but it's something far more human. Soviet medicine was a contradiction, a paradox wrapped in white coats and red banners. It promised the world equality, care, dignity, and sometimes it delivered. A child in a distant village got vaccinated. A grandmother received her pension and her heart pills. A doctor worked late into the night, not for money, but for duty. There were moments of real hope, of quiet compassion. But there were also shadows of bureaucracy, of fear, of silence, of patients treated like numbers, of doctors trapped between conscience and quotas, of a system that could heal the body but often ignored the soul. Today, its echoes remain, in buildings still standing, in policies still debated, in generations shaped by the memory of both care and control. And so we ask, what should a healthcare system be? Who does it serve? What happens when medicine becomes a mirror, not just of science, but of society itself? The Soviet Union is gone, but its medicine left behind a question, unanswered but not forgotten. Thank you for sitting by the fire. Until next time.